Good afternoon and welcome to Ali Ahmed Khan Hospital, and we are back today with another topic on COVID-19. So today is 24th of March 2020 and we are going to record a session for e-journal today. It's about, let me call that a success story about how the Taiwan was able to get a handle on this pandemic. So we'll be reviewing an article that was published in Journal of American Medical Association on March the 3rd, 2020. Title of publication was Response to COVID-19 in Taiwan, Big Data Analytics, New Technology and Proactive Testing. It was published by C.Jason Wang, MD, PhD and others. So let's talk about how Taiwan was able to achieve what they claim today they have achieved in terms of getting a control on this pandemic. So let's see what Taiwan is. Taiwan is 81 mile off coast of mainland China, and it's a country of 23 million population with about 4 lakhs workers that are working in mainland China. So we see Taiwan has a lot of and strong cultural as well as financial ties to mainland China. And it was expected that Taiwan would be having the second largest number of patients with COVID-19 after mainland China. It was expected. But it did not happen, and let's see the reason that why it did not happen in Taiwan with that much proportion. So this article highlights the measures that were taken by Taiwanese National Health and Insurance Agency and their government, their people, and it was a concerted effort actually, and they are still doing it. They're still taking measures. They have not relaxed it, and we will give you detail about the latest figures of COVID-19 cases in Taiwan. But let me remind you, Taiwan success about this COVID-19 is basically a lesson for all of us, other countries, about how to control this pandemic. And it also tells us how well prepared a country could be, regardless of the resources. Even countries and mighty economies with huge finances, they are not able to contain this pandemic. So what they did basically, they came up with a concerted effort, and basically their National Health Commission, they created a center for epidemic command and control center. It was the central authority, and probably they were already prepared for this epidemic in a way since the very beginning, as they had a SARS epidemic in 2003, and that caused huge loss of life. So they had their lesson learned since 2003. And they were very proactive. Since the day WHO declared this as pandemic, they have already taken proactive measures. They were well prepared. So what they did was they created this central epidemic command center. It created a 124 item checklist. Actually, it's a huge checklist, and we are not going to jot down and talk about all the checklist items, but I'll review it briefly. So basically, these were action items, and action items were recommendation and guidelines for other departments to follow. So it was coordination with other agencies. So what they did was integration of database. Integration of database was done in terms of healthcare alert, QR scanning, and basically they prepared online reporting of symptoms and travel histories. People were supposed to submit about their symptoms and travel histories to national health database, and from this national health database it was shared with other agencies like border enforcement agencies. And so let's first talk about action on border control, uh, travel restrictions, and control of cases. So what they did was they did risk standardization, they did risk stratification actually, and they issued SMS border passes to people who have disease, or they were given, it's about the health declaration, their health status. It was like they made it sort of mandatory for everyone leaving a country or entering this country to have these border declaration, health declaration. And what they did was they provided fast immigration clearances, and they did quarantine, and they were able to do mobile tracking of people who were put in quarantine at homes, even through intelligent softwares actually, and they imposed it strictly. They also created hotline for symptom reporting in their district, and like in a city or town, when their hotlines were sort of saturated, they created other hotlines for people to report their symptoms. And they also came up with compassionate care for people who were quarantined and who were reporting illnesses. They were not just taken harshly. They did not deal with people, although they did impose restrictions and penalties on people who broke quarantines. And they imposed several travel restriction bans, and did strict quarantine, and they did fastidious tracing of contact isolation. And they started expanded community-based surveillance. Like they came up with a sort of criteria. For example, if somebody had pneumonia and it's not going to recover with 3 days of antibiotic, so it was screening for COVID-19. And so we come to the next one, the resource allocation. In terms of resource allocation, as in other countries, they are having a crisis of resources and finances, and especially in terms of availability of personal protective equipment. So the main thing they did was they basically, first of all, assessed how much PPE they had already prepared and what was the capacity of manufacturing PPE. So they did a survey first, and they did price allocation, and from the article I see that they had 4 million masks per day when it started. Somewhere in February they had about the capacity of 4 million masks per day. So they imposed bans on its exports, and they started controlling profiteers, people who make money from hoarding of masks and other personal protective equipment. They devised quota systems, and they gave strict penalties to hoarders and profiteers. That's how they were able to control it. And other things they did was to repurpose their facilities. And repurposing of facilities in terms of they were like military camps and dorms. They repurposed it in the shape of quarantine facilities, and they were able to increase their mass production lines, assembly lines, and they even recruited dedicated troops and soldiers to increase their capacity. And from the article I can see that what they desired was a production of 10 million masks per day. That's a huge figure, and I think that they were able to come up with that figure with all those effort. And what else they were doing? They had what they call like some Chunghawas post. They had 3,000 Chunghawas post for mask distribution. Chongawa Post are like state-run agency that has a facility for distribution of masks. And what they did is to give 500,000 masks to children, to kindergarten actually. So probably they did not close their schools for that long actually. And probably they did it for 10 days, I think it's evident from the article. And they came up with digital application for seeing how many masks are stocked in pharmacies. So they were able to do it in real time. If some pharmacies are running short of masks or some are like having more in one place, so it was a sort of digital coordination with. And the government actually invested $6 million for equipment purchase. That's a huge figure, $6 million US. And they had their army reserve troops to, I already said, help production lines and across 28 manufacturing facilities. So they were making lots and lots of masks each day. So now we come up to the other measures. Actions on communication and policies. So they basically announced and imposed fines on people who were spreading rumors and fake news. They had like a Central Crime Investigation Bureau that was supposed just like FIA or Central Investigation Agencies in other countries. And they started investigating suspect. For example, there was a rumor that created toilet paper panic. Somebody started spreading news that masks are not enough or they are using toilet papers for production of masks. So it was curtailed. And they also investigated, and I think they also kind of imposed penalties on him on some Japanese. Actually, it was some Taiwanese who were spreading rumors in Japan that he has some chemical like cyanide that can ward off COVID-19 infection. They have harsh penalties. They did it very well. And the CECC, the Center for Epidemic Control and Command, it coordinated with their Environmental Protection Administration, their Environmental Protection Agencies, their Ministry of Health, their Ministry of Transportation for disinfecting schools and their public transports, railways, trains, buses, before they could be used. So there was huge disinfection efforts. And Ministry of Education, they prepared guidelines for classes suspension. For suspension of classes for like kindergarten, they came up with the regulation that if there is 1+ case or suspected case in a class, the class will be suspended for 14 days. And diagnosed case of COVID-19, if they had it, the class will be suspended for 14 days. And if it's more than 2 in a school, the school will be suspended for 14 days. And in terms of Ministry of Labor and Finance, the Ministry of Labor and Finance were able to extend financial assistance to workers who furloughed due to COVID-19. So they were not that harsh in terms of they were facilitating people. So we'll talk about latest figures now, what's going on in Hong Kong these days. So I'm quoting Hong Kong Premier, the Chief Executive, Carrie Lam. I just read a reporting on the Market Watch about the current rise of cases in Hong Kong. It's like third wave basically. So disease comes in form of wave. You have to keep on curtailing, you have to keep on mitigating and adopting the containment measures, but it will keep on coming. But cases will not rise in exponential figure, that is the main thing. So it's a third wave now, and they say they have 356 confirmed cases with 4 deaths. It's Johns Hopkins University figure, Johns Hopkins dashboard actually provides latest figure about cases, out of which 252 are active and 100 have recovered. And in terms of worldwide figures, we see that disease is almost nearing 400,000 confirmed cases. It's less than 400,000, 367,000 cases something. And we have confirmed deaths about 16,000 confirmed deaths so far, out of which 100,000 people have recovered. So what we get from this article review is the amount of concerted effort and coordination on part of governments, its agencies, and the very people of Hong Kong, Republic of Hong Kong. So the lesson learned is great things can be achieved with concerted efforts. Thank you very much. Thanks for listening.